Well, today we are diving into a topic that is on a lot of people's minds right now, especially as the temperatures drop outside, and that is back pain in the cold. Winter can be especially hard on our spine, so we are pulling in an expert, VSI spine doctor Colin Haines, spine surgeon, and knows everything about this because you lived it. Coming from New York, you were, growing up in some really harsh weather conditions, so you know this firsthand.
I grew up in the land of the snow, so absolutely.
So winter can be tough on our backs and it's prime time for back pain. So why is this? What does this season seem to worsen neck and back pain for so many people?
Yeah, I love having snow days. I always look forward to it. I get to play with my kids, and sometimes it's a day off from work or a light day. But I also have this kind of this monkey on the shoulder, knowing the following day is going to be a busy one. And unfortunately, a lot of people are going to injure their backs. The cold weather just brings on back injuries. One of the things we think about is, especially at a place like Washington D.C., where we get some cold, but it's more of a one-off scenario with the cold and the snow. People aren't as used to it. So we see the snow, we say, oh, shoot, I got to shovel it. We get up, we run out there, and we start shoveling with improper form and without warming up. The cold constricts the muscles, it constricts the blood vessels, much less, not even considering the lifting that's required. So the temperature alone makes our muscles less vibrant, less active. And that makes a little more risk to the spine in and of itself.
So because they're tight, they're more prone to injury.
You got to warm them up. If we
Yeah.
don't warm up our muscles, if we don't loosen them up, almost viewing it like a sporting event, we're more prone to injury because those muscles are not supporting the load that the spine requires.
Okay, we'll get into your tips on warming up and all of the things in just a moment. But first, are there specific conditions like arthritis or herniated discs that are particularly aggravated by the colder temperatures and even barometric pressure?
Yeah, I was just riding the elevator up with a primary care physician. He was saying the barometric pressure and the temperature is making his clinics very busy just from cold and flu season. There's kind of all conditions. I see it as a spine surgeon. I see a more biased group of patients who tend to have more back injuries,
Mhm.
but it definitely does. I see a lot of disc injuries, and they're really going back to the reasoning and the why behind it. The muscles I view as the armor for the spine. If the muscles aren't working well because of the temperature, then the spine is more susceptible to injury.
So, what about people who have chronic neck or back injury issues? Does cold weather make it worse? Does it influence stiffness and pain?
It absolutely can. I tend to see patients both who never had issues that start getting those acute injuries, as we are talking about. Without a doubt, thinking of those muscles again as the armor for the spine. If the muscles aren't working as well, it means that our threshold to tolerate more chronic conditions is decreased.
All right, let's get into some topics that are some tips that can really help people deal with this pain and with the cold. These are your top five winter back pain tips. What are the five things that how people can protect themselves in the winter months? First, you say, and you said it before, warm up before heading out. I hear you say this a lot. Talk about the importance of that.
Yeah, got to warm up. I mean, it's almost like working out. Like today before my workout, I didn't just jump on the treadmill and go for a sprint. I started slow. I stretched, and one simple rule. If you get the 101 course, I call it the 5-5 rule. Even I do this before working out, but I do this also if I got to shovel a lot of snow. 5 minutes warm up, 5 minutes cool down.
Okay.
That's essentially the 101 course. So we're going to dive in a little bit deeper, which, if you do the 101, I'll be happy. But the 201 is really split it up, half of each warm up and cool down, do stretching, and then do a little bit of light cardio. It doesn't have to be jumping around or anything like squat thrust, just gentle walking around the house before you really get into the shoveling activity.
Okay. All right. So let's talk about shoveling. And you say lift smartly. What does that mean?
Yeah, shoveling's really supposed to be a pushing sport, not a lifting sport. The
Hmm.
thing that risks are the discs, the shock absorbers in our spine the most. And the thing that really just puts the most force to them is when we bend over, when we lift up, and when we twist. And that is basically everything that if I'm shoveling improperly, I would be doing. When I shovel, you can get an ergonomic shovel, which is nice, kind of forces you to push a little bit more. But even if you don't have an ergonomic shovel that has that sort of gooseneck bend on it, put it in front of your waist and power through it. Almost view it as a plow as opposed to a lift.
Okay. And you made a really good point earlier about how, in this area, we're not totally used to snow all the time. So you think, go out, get the snow off of there, and you're doing it without warming up. But you're saying this is an exercise.
It is, I know we've talked about pickleball in the past, and one of the reasons people get injured in those sorts of sports, it's the quote weekend warrior mentality. People
Mhm.
say, 20 years ago I ran a marathon, let's go out and get after it. And they don't warm up before their sport and they get injured. Well, the same thing happens with shoveling. The same thing happens with snow removal. It really is. It's quite physical. You need to almost view it as a sport. So
Mhm.
because of that, because we're not doing it every day, and because we don't necessarily warm up for it, we're much more susceptible to injury if we just go out and do it cold.
Okay. And you mentioned the weekend warrior thing. You're saying stay active. Don't just be a weekend warrior, stay active. This is tip number 3, all year round, indoors, especially when, when it's cold, obviously.
Yeah, it's easy to be a couch potato when it's cold. Something we're going through in my own house where we just got a new treadmill because my wife, we've always been into cycling and we enjoy running, but I'm kind of wimpy now. I don't like to get out in the cold like I used to back in the day when I was in upstate New York. So we got a treadmill instead. So we're not trying to be sessile. We're just trying to stay actually as active, if not more active. And doing indoor workouts is a nice way to avoid that cold, but still keep your body on point.
Gentle yoga, core strengthening exercises, even walking in place. You mentioned the treadmill. I have a walking treadmill. I've talked about this on this podcast in the past, but that really keeps, because I love my outdoor walks, but the moving the treadmill when I'm working, that's exactly what I need.
Yeah, when it comes to exercise, there's a lot of new research showing that you don't have to be going to the point of exhaustion for an hour to get the
Mhm.
type of benefit you need.
Yeah.
There's a lot of more lighter exercise, constant exercise, going more. It's called zone 2, but basically elevating your heart rate, but not to the point of passing out, which we certainly don't want. And you do it for more prolonged periods of time. Not only is that good for the muscles, but that has a lot of really good benefit for the cardiovascular system.
So movement is medicine. All right, tip number 4, dress for the weather, you say. I mean, that's sort of duh, but maybe people don't think about it.
Yeah, no, it's true. I mean, it's I don't have as many parkas as I once did, and sometimes you say, oh, I'm running late to work. Let me just throw on a light fleece and get after it. And we need to properly prepare our bodies and have that proper armor for the temperature. Make sure
Yeah.
you have a good coat, wear gloves, wear a hat. We lose a lot of our heat through our head, so making sure the proper body parts are covered is really important in terms of tolerating the new conditions.
Super simple, huge difference. All right, and tip number 5, listen to your body.
Yeah,
What does that mean? I mean, you listen to your body, but what are you listening for?
yeah, I like to view this is kind of an intangible, but it's almost a common sense test. I use the litmus test for. There was a time where it's like my thighs are sore after my workout this morning. All right, a little bit of pain. That's a pretty normal sort of pain. If I were limping in here, that's a different ballgame. So I use this litmus test of saying, in general, if something just doesn't feel right, something may not be right. That's a time to say, press pause, go slow, potentially even get it checked out.
Well, I was going to say, what happens if your pain doesn't go away? Is that time to see the primary care or a healthcare professional, or how long does the pain have to go before you go see someone?
I have a pretty short leash on saying get it checked out. The
Mm.
worst thing that happens is you get it checked out, you get a clean bill of health, you say it gets some medication, you get back on the back to the normal much quicker. The worst thing you can do is wait and wait and wait. I know it's easy to do. It's very easy to sweep stuff under the rug, but you wait too long, the condition never got fixed. Potentially, then we're talking about something more significant from a treatment perspective.
Okay. All
So
right.
sooner is better, in my opinion.
I'm sorry. Say that one more time.
Sooner is better, in my opinion, when something just doesn't feel right.
All right, let's bust some common winter myths about back pain now. The one that I hear all the time is if your back hurts, just rest it. I know you just said come see your healthcare professional about this, um, but what's your take on rest versus action to go see a doctor immediately?
Yeah. So my grandmother, decades and decades and decades ago, probably 70 years ago at this point, herniated a disc and no one really knew what to do. And they said, lie in bed for a month. Right? That's a net negative. That's not a good thing. Right? We know much, much, much better now. So on one side of the spectrum, don't lie in bed all day. On the other side of the spectrum, don't power through and try to run a marathon. We want you to stay somewhat active, light activity. A lot of almost the warming up that we're talking about is actually good to keep your body moving. The reason for that, let's say you injure a disc, the shock absorber in the spine. What happens is you get that injury of the disc, but then the muscles spasm as a consequence. Basically, the muscles tighten up to minimize motion since motion hurts. So, what occurs is if you don't get moving and don't get cruising, those muscles spasm and tighten up even more, it becomes a sort of vicious cycle. We
Mhm.
want your body to gently be working out while you're progressing through the healing phases.
So it promotes circulation and really prevents that stiffness that you said can be, detrimental to the body.
Absolutely.
Yeah.
Keep moving, loosen those muscles up to make sure that those muscles, again, are protecting your spine.
Even if it's just simple movements. What about the idea, you mentioned your grandmother, that oh, back pain's just part of aging. Like that's you just got to deal with it. What's your take on that?
I also think that's a myth as well. It doesn't mean that when you're 90, your body's supposed to be functioning like it's 20. Obviously, we go through aging phases, but it's not normal to hurt. And I almost feel like that's become the mentality. And
Mm,
I don't want to feel like that. I don't think people need to feel like that. There are a lot of things that we can do from a preventative perspective so that it doesn't occur. And even if that does occur, doesn't mean you have to accept the status quo. There are some treatment options. So, moral of the story is as we age, you don't have to suffer.
okay. Well, that's good news. How can someone differentiate between normal winter stiffness and a back injury that needs medical attention? Because we're all, like you said, feeling a little stiff in this cold. We need the warm up, but when you're feeling that, what's the difference between just stiffness and an injury?
Yeah, sometimes a little tough for the common non medical person to really differentiate the two, but it really is if it doesn't feel right, it really may not be right. When it's not just that slight ache, when it's a ouch, this hurts.
Mhm.
That's when I tend to view that difference of saying, okay, get it checked out if it's a real ouch.
That goes back to listening to your body.
Yeah.
Is there anything else that you want more people to know about preventing back pain during winter?
Well, when prevention is really everything. Maintenance of not just the spine's health, but the overall musculoskeletal system's health gives you more tolerance, gives you more wiggle room to do some activities.
Hmm.
If someone is deconditioned, they're at much more risk of injuring their back by doing some light shoveling. If someone has a much more ideal combination of core stability but also flexibility, that's when we have more tolerance built into our bodies. Like you said, prevention's everything. And if we can really get our bodies in an optimized scenario, it basically means we're not as prone to injury and we tend to
Hmm.
hurt less.
All right, I want to dig in a little bit more with some key takeaways on that prevention piece that you just talked about, and best practices too. For people who are a little more active during the winter, what type of footwear or safety measures can help reduce the risk of falls and especially on icy surfaces?
Yeah, I was just talking to a friend. He and I are a little bit of a pseudo running club. And I was saying, well, we need to get back out and run. And he told me that, and I didn't realize this. He said he was running one time, slipped on black ice, hit his head, passed out, and basically woke up concussed.
Oh my
And
God.
yeah, you got to be more careful in the wintertime, right? I mean, there's no doubt about it. Making sure that especially if we're running, make sure you're having proper headlight. Black ice is tough to see no matter what, but you got to be very careful. Make sure you're running on a good paved surface with some grip. Ideally, in an area that especially if it's prone to ice, it's being salted from a preventative perspective. Then, when you're even if you're not running, just going out with the proper footwear of having good tread on. We don't want people slipping. That's where this stuff we're really thinking about. Get good boots. Also keeps your socks dry, so it's less annoying.
Yeah. I'll bet you see a lot of people during the winter who have fallen.
There definitely are some falling injuries. I saw that a lot, back in my residency when people would be breaking their wrist. The wrist
Oh,
fracture rate is very, very high. As a spine surgeon, I don't treat that as much anymore, but certainly that's something that's endemic during the cold season.
okay. All right. And I want to go a little bit deeper on that stretching that you talked about. What specific stretches, exercises do you suggest before heading out in the cold to prepare your body?
Knowing that no one has an hour to stretch before they go out in the cold, and I certainly don't myself, I try to keep it pretty short and succinct. What I do myself, so I do a quad stretch, so standing, pulling the leg back. I do a hamstring stretch. And then specific to the core, I do some cat cows, and then I do the rotation side to side. And those ones seem to keep me limber enough and loose enough and get the blood pumping enough that thus far, don't want to jinx it, I haven't injured myself in this.
Okay. And I don't think we can overstate it enough. You talked about the shoveling, and using the ergonomic shovel. is there proper form? What are the most common mistakes you think that people make when they're shoveling snow, and how can they avoid injuring their back?
Yeah, it's the lifting. We really want to make sure shoveling is a pushing sport, not a lifting one.
Okay.
When I do it, so I actually don't have an ergonomic shovel. I have this big, almost sort of plow type shovel. I put it on my waist and I push forward. So I really power with my legs and view it as a pushing event as opposed to lifting. Where people can get into trouble is if you shovel, lift, twist. That tossing, especially when we think about, it's a lot of repetitive activity, but snow's heavy. Snow can be very, very heavy, and we're lifting it very far away from our body. That weight gets magnified and transmitted directly to the low back. So avoid that lift, twist, toss maneuver.
It's actually a really good workout,
Yeah.
but you need to work up to that and do that stretching that you talked about, the warm up piece. What are some effective ways for people to stay active, to maintain their back health during the winter, and especially for people who may be more sedentary at this time of year?
Laura, you mentioned it. Walking's a good exercise. Walking is good for the cardiovascular system. It's actually really good for the core. When we walk, we have to contract certain parts of our muscles, especially the glutes, to keep our balance. So walking is really good. What I do for myself, and this is something I very powerfully take with me, my story. I injured a disc when I was in high school, and I used to get some periodic pain kind of through my 20s. My back would ache for a couple weeks a year, never terrible, but enough that it would annoy me. Then I do my exercises, and then it would go away in a week or two. Well, what I do, I just haven't had, don't want to jinx this either, but I haven't had any back pain, any achiness over the last probably 7 years. And I'm a firm believer it's because I've been more diligent about doing the proper core exercises. So what I do, and this doesn't require me going outside, I do about 5 to 10 minutes on my core every single day. I do planks, side planks, bridges, and bird dogs, and different variations of those. And by doing those in isolation, it's kept me really out of a world of hurt.
Yeah, that core strength really protects your back. Let's talk quickly about, before we wrap, about specific ergonomic adjustments for your work at home environment, because a lot of people are indoors and, like we said, this time of year. So anything that you would recommend? I mean, we were just talking about tech neck. You were on Fox 5 talking about that, and having things level with your eyes. Any other advice?
Yeah, if you can raise that desk up so you're looking relatively out with the horizon, that's a lot safer for the overall spine. When we're staring down at the ground, it's rough on our neck, but also kind of tricks us into hunching forward at the low back. When we hunch forward, we squish the discs a bit more. We apply more pressure to those discs, those precious shock absorbers we want to protect. And over the short period of time, like, the spine's designed to move. It's okay to tolerate periodically, but when we do it hour after month after year, that's when those injuries really add up. If
Okay.
you raise that monitor up, it's amazing that all of it, when I do it myself, when I raise the monitor up, my neck feels lighter, my low back feels lighter. So if we maintain the proper ergonomics, that's critical. Also, just take as many breaks as you can. I know it's hard when we're engrossed in our work. Set a timer. Maybe, sometimes we need that trigger to say, hey, time for me to get that break. Or even mention the walking pad. That's fantastic. Gets you upright, keeps your blood, keeps the heart pumping, and keeps you moving.
All this talk has me standing up a little bit straighter.
Yeah. It happens to me every time I talk about posture in the office. Everyone just sits upright a little bit more. So myself included.
I know, it's terrible. My posture is terrible. I'm working on it though. Thank you very much for that advice. Any final words of wisdom, final advice where people can learn more if they have back and neck pain?
Yeah, the spinal healthcare is evolving like crazy. We've grown a ton, but we continue to grow even more. Check out our Instagram. My Instagram's at Dr. Colin Haines. Check out our website, spinemd.com. We're always putting out new tips and tricks. And especially in the cold season, we try to make it very much coined towards what's pertinent in the outside world.
VSI spine surgeon, Dr. Colin Haines, thank you so much for your insight and your expertise and keeping us active during these cold winter months. Appreciate it.
Thank you, Laura.